You're watching CTOM TV. Knowledge is power.
Is HER2 cancer as common as other types of breast cancer? And is it more or less deadly than other types of breast cancer?
I'm not up in the epidemiology. It changes a lot, and you have to include HER2. HER2 is based on the amplification of the HER2 receptor. And so it's how many of those human epidermal growth factors receptors you have.
And is that determined, like, would a pathology or a blood test?
Yeah, so it's done by pathology.
Okay,
they take a certain amount of cells and they count the cells that stain positively for HER2.
Okay.
And there's two different ways. There's IHC, immunohistochemistry, and then there's also what we call FISH-based processing,
Okay.
Which is a little different.
All right. So your pathologist would determine the percentage of how many HER2 cells?
How many HER2 positive cells?
HER2 positive cells, and then that would determine what?
Determines whether you're going to respond to HER2 therapies,
Okay.
and whether your cancer is HER2 based.
Okay. And what percentage would be a yay or a nay? Or
the description is 3+.
3+.
Yeah.
Okay. Okay. So is it as common as other types of breast cancer?
I don't think so. One of the negative things about HER2 cancers is they have a preference to metastasis to the brain. And so that could be a problem.
Yes. So you want to take care of that really fast.
Yeah, definitely.
Then, so that doesn't happen. Right. So that kind of gets to the next question that Christina had, which is it more or less deadly? So if
it's more treatable, it's also fairly deadly. But I mean, there's types. Once again, you have to look at the individual genetics. You can't just look at HER2. I mean, traditionally we've subcategorized breast cancers as ER positive, HER2 positive, and triple negative. But we've got, as we discussed last week and through the last few sessions, there's so many different variations. There's androgen receptor triple negative positive, there's androgen receptor HER2 positive. We've just seen every possible combination.
And for each of those combinations, there would be a different appropriate combination of targeted therapies.
Exactly, combined with the standard therapies.
Right. So
the one thing with HER2 that we do know, and we have just created a liquid biopsy test for that, exosome-based liquid biopsy test. The amount of HER2 variation, in other words, the copy numbers of that gene, which is associated with how many receptors you typically have increased copies of the HER2 gene. The amount of copies varies not only between tumors, but it varies throughout the course of the disease. And it also varies between cells in the same tumor. So you can have an ER positive breast cancer that can go on to develop HER2 amplification. You can have a HER2 amplified gastric cancer or breast cancer or something that loses its HER2 amplification. And so one of the things we do is we test for that with our liquid biopsies, and we look at the copy number ratio of the HER2 gene overall across all of the tumors in the body. And so if we see, and what we've seen, and others have seen this too, this has been well published, is that when you're treating a person with HER2 positive breast cancer and you do these liquid biopsies, you will see if they respond, the copy number of the HER2 goes down. If they don't respond, the copy number goes up.
So that's one way to assess how well they're responding.
And we're talking the overall copy number. It's only detectable through liquid biopsies because you're looking at the summary of all of the cells in the body, not just some of them.
So if you have HER2 breast cancer, you're being treated for that, there's a way to make sure it's working as well as it should.
And the mechanism is that when you're looking at a liquid biopsy, you're seeing the copy number of all of the tumor cells, literally, and you just get a higher percentage of HER2 positive cells that bumps the copy number up overall.
Wow, that's interesting.
Yeah.
Thank you for watching CTOM TV. Subscribe below and stay informed.